Train for a professional career in healthcare in as little as 2 years at Labette Community College. Earn training from some of the most well-respected allied health programs in the state. Earn a degree in as little as 2 years in nursing, radiography, respiratory care, PTA. After completion of the first year of curriculum, students are eligible to take the NCLEX to become a licensed practical nurse. 100% of LCC nursing graduates find employment in the field of nursing. Projected income in this area upon graduation is about $36,000 to $42,000. Gain valuable skills in the classroom to better prepare you for the workforce. Hands-on training with one-on-one instruction. State-of-the-art technology. Pass rates are above the national average. Upon completion of the second year of the nursing program, graduates will receive their associate's degree in applied science and are eligible to take the NCLEX RN to become a registered nurse.
Reputations they have in the Joplin, Missouri area is a very, very positive one.
It's a small classroom and you get a lot of one-on-one with your instructors. They want you to succeed, they don't want anybody to fail.
And so I actually chose to travel the extra, well, it takes 45 minutes. And I actually chose to do that because of the reputation of the school. And word of mouth from others that have gone through the program and have just really been a positive experience for them and for and as far as the faculty and the program itself.
There's so many fields in nursing that you can go into that it's just, there's so many options. The technology's real well. We've got a lot of simulation time in the labs where we work on the mannequins, and they have all the equipment here just like you would be in the hospital. I've
known all along that I've wanted to protect and provide, and I actually do have a bachelor degree in criminal justice administration, and then found out after that how much I love healthcare. And so, as a result, I've been blessed to be to work in the hospital, and fell in love with it. And that's why I'm back in healthcare now, wanting to pursue my degree.
Well, I've worked in the healthcare field for 20 years, and decided to move on and get my nursing degree here at Labette. It's close to home, and it's a 2-year program.
The average salary in Kansas for a PTA is around $35,000. Physical therapy assistants work under the direct supervision of a physical therapist to help patients increase their muscle strength, improve mobility, and relieve pain due to injury or medical condition. Specifically, patients may seek the services of physical therapy because of disabling conditions of lower back pain, arthritis, a neurological disorder, or the inability to easily move arms and legs due to an accident or long-term injury. As a physical therapist assistant, you would not only work with individuals to help them recover from injury and ailments, but also prevent injury by teaching patients how to avoid further injury by promoting good practices in overall fitness and health. PTAs are trained to conduct therapeutic exercise, provide therapeutic massage, observe patients and evaluate data on patients' progress. A physical therapist assistant may also fit or adjust supportive devices such as leg braces and or crutches. The need for PTAs will grow in the state of Kansas by 24.1%. Regionally, career growth is projected to grow by 42.9% by 2012.
I chose LCC because it's local and affordable. It makes it easier on my family.
I've always been interested in the physical therapy field. I've got family that's in the healthcare field.
I received several scholarships that made it extremely affordable, especially with a family and with today's economics, that made it extremely affordable to go back to school. Made it an easier decision.
The scholarships make it more affordable and easier to go to school while working and raising a family.
I've got some friends that are PTAs and had been speaking to me about it for quite a while. It's something that I've always been interested in, but with their help and with the potential of the school coming to Parsons, made it an extremely easy decision for me.
LCC has a 100% job placement rate within 6 months of graduation. Our program is 23 months in length with new classes starting every summer. Beginning salaries after graduation are between $32,000 and $36,000 in this area. Graduates work in hospitals, clinics, doctors' offices, imaging centers, and some are traveling technologists. The best thing about the field of radiography, known as diagnostic imaging, is that there are so many possibilities for advancement in the profession. With an additional year of training, graduates can specialize in ultrasound, nuclear medicine, or radiation therapy.
I decided to do the radiography program back when I was in high school, which was forever ago. I'm kind of old, but I just never got into it. I quit school and started working. And I had a counselor in high school, though, talk about it and say that it was something good to go through. So I thought about it a long time, but I just sort of got away from it. Then a couple years ago, I decided, well, I'll try it again, go back to school. And so I heard about the Labette had a program, and there's a few other ones around, but this one was closest, and I knew my way around this area pretty good. So I decided to come over here, and I heard it was a really good program and everything. It's more affordable than anywhere else I've gone.
Well, for me, it was a career change. I'd operated in a business for 30 years, and I was getting to a point in my life where I knew that I needed to either do it now or take that off the table. And it's something that I've always wanted to do and toyed with it over the years, and I just made that decision to go ahead and do it.
Well, out of high school, I didn't know what I wanted to do. Man, someone just kind of recommended it to me, just, see if I would like it. And I have scoliosis, so I was always getting x-rays as a kid, and I was around it a lot, and it never really occurred to me that'd be something that I wanted to do, but as I kind of learned more about it, I figured I'd give it a shot and see if I liked it.
A lot of hands-on. The classes are good, teachers are good, they're really kind and everything. They help us out a lot. It's just a really good program, I think. Every day you're doing something different.
There's a good balance between classroom instruction and clinical hands-on training. So I know that when you get out, you're going to feel confident that you know what you're doing and you can fit right into a department.
The pass rate here is real high, and it was really close to home. I only live like 20 minutes away, so it was really convenient for me.
New digital stuff and everything, not having to do it on film, and with all the computer stuff, it helps out a lot. It's actually easier for us because we've been doing computer stuff for a while. So.
I have a bachelor's degree in another area, and so I had kind of extinguished all my grants and scholarships. So really this is coming out of my own pocket, which has probably been a good thing because it's made me try just a little bit harder. I know when it's coming out of your own pocket, you're just trying harder. Well, I like the hospital setting, I like working with the patients, and I like the family atmosphere of most of the hospital departments that I've worked in so far.
A respiratory therapist is an essential member of the healthcare team. Like other allied health professions, the respiratory therapist, or RT, works under the direction of a physician. RTs participate in the diagnostic evaluation and management of patients with deficiencies of the heart and lungs. RTs are also responsible for life-saving tasks such as mechanical ventilation and care of artificial airways.
As a kid, I had severe asthma, and there was always an RT on staff. I actually have relatives that are RTs as well, and so I shadowed them and figured out that's kind of the path I wanted to go. We all work together. Instructors work with you very well. I mean, they want you to succeed. It's great. I've had a great experience here.
I would like to hopefully be able to work somewhere here locally in this area where my family is.
Hopefully get a job. That's the first thing, and then go from there and see where I do end up.
Well, when I came into the program, I kind of had my mind set on going into an ultrasound program. I don't know if I'm going to do that at this point. I would still like to, but it's been 2 long years of studies, and it's going to take some some effort for me to want to go right back into that.
I want to get more of an experience when I get all my clinicals done. Then I'll make my choice then.
A hospital, just anywhere really. I could find a job anywhere that they need help.
I'd rather work around this area. I really don't want to move away, so it's just because I kind of like it around here.
Imagine working with doctors and other healthcare professionals to help people. To find out more, see our website at www.labette.edu or call 1-888-LABETTE or stop by our campus at 200 South 14th Street in Parsons. Financial aid is available for those who qualify. Labette Community College, where it's all about you.